Hello, I am Dr. Pramila Kalra, Professor and Head, Department of Endocrinology, Ramaiah Medical College and Hospitals. We know that we observe Diabetes Day every year on 14th November to create awareness about diabetes mellitus. It is also important to know that if the glucose control is not kept properly, then patients can develop multiple complications because of diabetes. So, there can be damage to the kidneys, which can manifest as protein leakage. Patient can even need dialysis later. For the eyes, the patients can have initial visual blurring, but later on they may even have blindness if not taken care of. The patient can also have effect on his or her nerves, because of which the patients may have burning or pain in the feet. They may even get foot ulcers because of loss of sensation. So it is very important that the blood glucose control is kept properly and the monitoring is done at a regular basis. How do we do the monitoring? We have to check the fasting, the postprandial glucose values, and also HbA1c, which is an average glucose value of the past 3 months. We also need to sometimes do continuous glucose monitoring for few patients to see if they have more of glycemic variability. So, if the glucose control is kept properly and if the patient is regularly followed up, we can actually prevent these complications to a great extent. Even if the complications have started, we can also retard the progression of these complications and prevent the damage to these organs by following up the patient regularly and giving them some medicines, or maybe if they have retinopathy, giving them laser therapy if needed, or some injections. And also for the kidney, some medicines can be given to prevent the damage. And similarly, for the nerve damage, we can counsel the patient about foot care and we can do multiple other things to help the patient. So, the take home message is that if a patient has diabetes, we need to see that we keep the glucose control very good and we follow up the patient regularly, at least once in a year, for the development of complications. For the glucose monitoring, we need to follow them at least once in a 3 months' time to see if the glucose control is good. Thank you.